kind of as we know it at this moment in time. Back a little bit and think about this disease and about the virus that causes it, and just talk very briefly about COVID-19. So that is the term that was given to the illness caused by the coronavirus, SARS-CoV-2. And we know that it can be very serious and have lasting effects. We also know that in some people, it causes no symptoms at all. So it really is a really wide range of illness. We also know that it's pretty easy to spread this virus around. And the way that it's spread around primarily is through these little droplets, the droplets that we make when we breathe, when we talk, when we cough, or when we sneeze. And if I go to the next slide, you can sort of see that. So this is a sneeze, and you see all those little droplets? Well, we're still making those droplets even when we're not sneezing. So even when we're talking, breathing, etc., we're making those droplets that go out into the air. And the good news is the vast majority of these droplets fall to the ground within 3 to 6 feet. Some of them do stay in the air and can travel a bit longer, but the vast majority drop within 6 feet. The other thing that you'll be able to notice immediately is if you put a mask on this person, all of those droplets would go into the mask and would not be spread either feet or yards in the distance. And that is really the primary purpose of the mask, is what's called source control. So people who are infected, whether they know it or don't know it, and they're making those droplets, we'd like those droplets. The mask over your nose and mouth will prevent those droplets from becoming airborne. Well, what about the disease? So what we can say is many adults and most children will have no symptoms at all when they're infected with this virus. Some will get a flu-like illness, and it has all of the flu-like symptoms: fever, chills, cough, difficulty breathing, shortness of breath, fatigue, body aches, headache, all the things you think about with the flu. The only thing that's kind of specific for COVID-19 is this loss of taste and smell. And the good news is that for most people, that's a transient loss of taste and smell, and it comes back completely, but it can take weeks to months for the taste and smell to come back. Now, some people are going to have lung disease. The virus is going to get out of the nose and the upper airway and get down into the lungs and cause pneumonia, lung disease. And that can go on to respiratory failure, so that you need a ventilator to help you breathe. Or there can be many organs that fail: the kidneys, the heart, there can be the liver. All of these can fail as well, and a person can end up in an intensive care unit and go into shock. We know that severe disease and death is much more common among older people and among people who have those other, what we call comorbidities, or those other illnesses, other underlying problems that they had before they got COVID, that COVID then makes all the worse. Well, what about children? How do children fit into this? Well, children really rarely get ill when they're infected by COVID. Now, this may change. Some people are noticing that the different variants are causing a little more significant and severe disease in children. But although many children, literally millions of children, have been infected to date, they really are not the people who are ending up, usually not the people who are ending up in the hospital or getting into severe trouble. However, this epidemic has greatly affected children. They've lost their family, they've lost their friends, and the numbers are 40,000 children in this country have lost a parent. Hundreds of thousands of children have lost an uncle, an aunt, a grandparent. And all of those children are kind of in isolation. we haven't been able to grieve in the way that we normally grieve. We haven't had funerals. Things haven't been the same. And this has a tremendous effect on children. Some of their parents have lost their job or had their salaries decreased. So if they were in poverty, their poverty is more significant or more severe, or they may have been doing all right and now they are plunged into poverty. Also, our children have lost the opportunity to have in-person schooling, and we know this has a tremendous effect among children. We also know that this epidemic has led to isolation and inactivity, not only in our children, but also in adults. And we've seen that the epidemic of obesity has also increased during this time when people are isolated and not having the usual activity that they have. We also know that children have missed out on their routine well child visits. So they were in the early part of the pandemic, they were afraid to go for the visits because you weren't supposed to go out. You were supposed to be, in lockdown at home. But even as things opened up, many people were very reluctant to go do those well child visits. And now we're seeing that we know that the immunization rates with the regular vaccines that we give are way down in children because of the pandemic. But not only have immunizations been missed, that usual screening that pediatricians do or that family physicians do, children are screened for their development, to make sure their language is appropriate, to get early diagnosis of things like autism, which require rapid intervention. So all of that has gone by the wayside, and the ability to give anticipatory guidance has been much less during this pandemic. So children, although they're not primarily the ones getting sick, have certainly been affected in a big way. So that brings us to why we want everybody to be immunized, because we think that these vaccines are going from getting sick. They will protect yourself and they will protect others. And what we want to do is to get to this point where enough people in the community have been protected and immunized, or they're immune, and therefore the virus can no longer spread from person to person. So are the vaccines safe? Absolutely. Vaccines, they do have genetic, that is part of your genetic material, but it's not the nucleus. It's not that DNA that really is your genetic makeup. And this messenger RNA can't do anything to change or alter your DNA, your genetic makeup. So a lot of people ask, how did these vaccines get developed so quickly? Usually it takes years for a new vaccine to be developed and tested and manufactured. Well, what happened was several things. First of all, the technology is not really new. So messenger RNA vaccines have been worked on since the early 2000s and were being developed for the first SARS outbreak way back in 2003. The adenovirus vector vaccines, which is the type of vaccine that J&J is, that technology is from way back in the 90s. So it's not really new technology. But the other major reason that this has been so quick is that the phases that a vaccine has to go through to prove that it is safe and effective, instead of them being finish phase 1, check out the results, go to phase 2 if things look good, then go to phase 3, instead they've overlapped them. So partway through phase 1, and phase 1 trials are you take a few adults and you check to make sure you have the right dose and that there aren't major side effects. Then phase 2, you take hundreds of adults and you know what dose you're going to give them. You give it to hundreds of adults and you monitor them very closely to make sure that there aren't any unexpected side effects. And then phase 3 is when you see, does the vaccine actually work? You're also still monitoring for side effects, but you're seeing, is it effective? And these trials, again, were overlapped. the other big difference is that the companies were told, go ahead and start manufacturing the vaccine early on. As soon as you get partway through phase 1, go ahead and start making vaccine. We will allow you to do that because we think it's so important that we get these vaccines and we get them into people's arms in a timely manner. So that's the reason that these vaccines were made so early. It didn't skip any of the phases. It didn't skip any of the looking for the safety. It just speeded the process up and took a lot of the red tape out of it. So another question people ask is, why do you need 2 doses? Well, you need 2 doses to get maximal protection. You do get some protection rather, after the first dose of the Pfizer and the Moderna vaccine. And of course, for the J&J vaccine, you only need 1 dose. But for Moderna and Pfizer, to get the best protection, you need that second dose. And they're spaced at about 3 to 4 weeks apart. Remember that even after you're vaccinated, you still want to wear the masks and you want to practice that physical distancing, that keeping that 6 feet away. That's still important even after you're vaccinated. Now, as I mentioned, 2 vaccines or 2 doses are needed if you have the Pfizer or the Moderna vaccine, but just 1 dose for the J&J vaccine. And as you know, the J&J vaccine is currently on pause. We're waiting to see because there were some unexpected side effects. That's being investigated, and we will find out actually later this week what's going to happen with going forward with the J&J vaccine. So what should you expect before and kind of during and after you're vaccinated? Well, what we want you to do ahead of time, and I love that this is a library group, so you all know and are into learning. So we want you to learn about the vaccines. Go to trusted centers, trusted sources rather. Look at the CDC website. Look at the New Jersey Department of Health website. Take a look at that and see, learn about these vaccines for yourself. Then when you get vaccinated, you're going to get a vaccine record card. Be sure you hold on to that. Be sure you read the fact sheet that you're provided with when you get the vaccine, and go ahead and make that that appointment for your second dose if you need to have the second dose. And in some cases, it will be automatically scheduled, but just make sure that you get that second dose. And then when you're done the vaccine, enroll in the CDC VSafe. This is a special monitoring system for vaccine safety. And you will actually get texts from the CDC reminding you that you need a second shot, but also asking how you feel and if you're having any kind of side effects. Now, expect side effects. Side effects occur because the vaccine is making your immune system work. So we expect your immune system to kind of give you some aches and pains and sometimes fever. Those are expected side effects. There are some rare serious side effects that also occur. And all of these monitoring systems are watching out for those. And then continue to use all those measures to protect yourself and others. So wear the mask, wear it appropriately over the nose and mouth. Be sure to stay 6 feet away and don't go into crowds. And if you don't feel well, stay home. Don't expose others if you're feeling sick. And try as much as you can to stay away from crowds and to stay away from people who are sick. So what are the usual side effects? So the usual side effects are pain, redness, and swelling where you get the shot. That tiredness, headache, chills, fever, nausea, all that goes along with your immune system working and being active. And those side effects are very normal, and they usually will go away within either overnight or within 24 to 48 hours. If you're worried about side effects, or if you're worried about something that seems to be getting worse after a day or two, talk to your doctor, make sure that this isn't an unusual side effect. The very serious side effects, the one serious side effect is anaphylaxis, or a severe allergic reaction. That has been seen with the messenger RNA vaccines, the Pfizer, Moderna. And the other very serious side effect is the blood clotting problem that has us on pause for the J&J vaccine. That blood clotting problem is very rare. It seems there were 6 cases reported after about 6.8 million doses. That's why the vaccine was put on pause. But we're trying to learn more about that. These are significant clots. They're in the blood vessels that are surrounding the brain, and some of them have been in the abdomen. So serious clots. And because of that, there's a pause till we really figure out exactly how common this is, and if there is a group of people who have not had that problem. So all of that will be discussed later this week, and we'll have a decision on what's going to happen with the J&J vaccine. So good news now is that everyone who's 16 years or older who lives, works, or studies in New Jersey, you're now eligible for the COVID-19 vaccine. You can schedule an appointment either by going to the website, and you can now schedule appointments directly on the website, or you can go to a link that will take you to the pharmacy or whatever, or the hospital or the doctor's office, or whoever has the vaccine, that will take you to their scheduling system. And obviously appointment availability depends on vaccine supply, but we're having a lot of supply of vaccine now. So those appointments are opening up very nicely. This is the number to call if you don't have a computer or if you need help in getting scheduled and getting registered. Now, this is the COVID-19 New Jersey Gov webpage that tells you all about the COVID vaccine. And it tells you how you get vaccinated, it helps you get an appointment, learn more about the vaccine, and that gives you all the vaccine statistics. So you go there, you can sign up for the New Jersey vaccine scheduling system, and you can directly book a vaccine site, or you can register with the site. And again, it gives you that link. This is the call center, as I mentioned before. And the good thing about this call center, it's open every day from 8 a.m. to 8 p.m. They have people who speak a variety of different languages. So whatever your language, you can still call that line and get help. And then if you're a senior, if you're 65 years of age and older, there's a special senior hotline, because we're really aiming to try to get all of our senior population vaccinated, since we know they have had the highest likelihood of getting seriously ill, of being hospitalized, and of dying. So we really want to get them protected. What information do you need to make an appointment? You need that personal information. There'll also be some medical screening, and you'll be asked about your occupation. But you give this information. Right now, everybody is eligible. In the past, we needed more information to figure out who was eligible, but as of this week, everybody's eligible. What should you bring to your appointment? Well, bring whatever you got when you go to your vaccine appointment. Bring whatever you got as a confirmation email or QR code, and you will probably be asked to, certainly you'll be asked to provide your name and often your date of birth, so you can make sure that the person who shows up is the same person who scheduled the appointment. You do not need proof of insurance. You do not need proof of documentation that you are legally in the country, and no one should be asking you for any specific information. If you don't have insurance, if you do have insurance, they will ask you for your insurance information, because the vaccination site can bill your insurance company, but they will not bill you, and you can't be back billed, and you will not be turned away because you don't have insurance. And don't forget, if you're deaf or have difficulty hearing, you might want to bring that communication checklist that will help you when you get your vaccine. What else can you do to prevent the spread? Well, we want you to wear that mask, wear it over the nose and the mouth, stay that 6 feet apart from others, avoid crowds because it's difficult to stay 6 feet away in a crowd, avoid particularly poorly ventilated indoor spaces where there's droplets may stay in the air a little bit longer, or you just can't avoid them as well. Wash your hands often, use hand sanitizer if there's no soap and water. And then as soon as you can, and now everybody's eligible who's over 16, go ahead and get vaccinated. So where can you learn more? Well, call the call center. They can ask, they can answer your questions. That's one of the reasons they're there, and they're happy to do that. Also, you can go to that COVID information hub, and you can get a lot of information there on just about everything. And remember that many languages other than English are available through the call center, and some of the up-to-date information is available in both Spanish and English. And then remember, there's a COVID app on your phone that you can do, and it's New Jersey, the New Jersey COVID app, and that will actually remind you every day. It will ask you how you feel, and it will, if you allow it to, it will tell you if your phone has been near someone else who had COVID disease. So very nice way to ensure your safety. So get that download that COVID app if you'd like to. So the other thing we'd ask you to do is really spread the word. Anyone who's gotten the vaccine and had a good experience, or, even if you didn't have that great of an experience, but now you're really excited because you're immune, let your friends know, let your family know, tell other people, get them immunized for the safety of everyone in New Jersey. And at this point, I'd like to stop, and I'll stop sharing. And we can go to some questions. And also I'll give Deb Cornabacca a chance to just tell us something from the front office.
Hey, Dr. Fisher, thank you. That was an incredibly great presentation and really comprehensive of where we're at. I hope it gives everybody the overview, the extent to which we're trying to serve all the variety of populations across New Jersey who need vaccines, people who are homebound, people who live in high rises, people who are deaf, people who speak different languages, people in communities of color where we know there's increased vulnerability to the virus. And that equity is something I know has really shaped the work that you and the DOH are doing, for which we're incredibly grateful. And for those of you who may not know Dr. Fisher, who is a world-renowned pediatric infectious specialist, an author of many works that I can't pretend I could read and understand, and editor of journals, is also a consultant with the DOH. And we've been the huge beneficiary of your expertise throughout all of this. So I think, rather than me sending maybe a little bit towards the specific issues of Johnson & Johnson and some of the trepidation that has been created around the pause. I know you mentioned the pause and the causes for it in the presentation you gave. But specifically around people who may be concerned or reluctant right now to get the vaccine even prior to the Johnson & Johnson pause, what would you say to them about why we should still be thinking about getting vaccinated?
So the pause is because of those really rare blood clots, but very serious blood clots. So if you've already gotten J&J vaccine, if you were vaccinated a month ago and nothing has happened, you need not worry. You're not going to be you're not going to be that 1 in a million who gets in trouble. So these are people who were vaccinated in about the last 3 weeks, and for whatever reason, their body makes an immune response not only against the COVID, the spike protein, which is what protects us, but they also make antibodies against their platelets, against the little parts of your blood that helps your blood to clot. And if you have this particular situation, then clots form, and these clots form in very unusual places. So if you would have severe persistent headache, if you would get very bad abdominal pain, if you have swelling of your legs or shortness of breath or chest pain, you should see a physician and immediately get to an emergency room if possible, and really get checked out to ensure that there's nothing more serious going on. As far as what I would say to everybody else, if you haven't been vaccinated yet, we do want you to get vaccinated. The Pfizer vaccine and the Moderna vaccine have not had this problem with clotting. So there's no reason for you to be reluctant to get those vaccines. Granted, it's 2 doses instead of 1. So the nice thing about J&J is 1 and done. But with Pfizer and Moderna, these are very effective vaccines. 2 doses, 3 weeks apart for Pfizer, 4 weeks apart for Moderna. So I really would encourage people to go ahead and get vaccinated. And, some people say, well, maybe I'll just wait a little bit longer. And I just remind everybody, we're not done with this pandemic yet. Yesterday in New Jersey, we had 2,390 new cases of COVID disease. This is resulting in new hospitalization, and reported yesterday were 40 deaths. So yes, sometimes it's a very nothing disease, but this can be a very, very serious infection. You could get sick, or you could take that virus to your parents or grandparents and you could make them sick. So really the best thing you can do to protect yourself and protect all the rest of us in Jersey is to get vaccinated.
The wise words from an expert that we know we should listen to. Do you have a sense of how we're doing towards reaching our goals? We know the governor had said 70% by the end of June.
Yeah.
And especially with the pause, people want to know, how are we doing towards that goal? And what does that goal mean for us? Does that mean we've reached herd immunity?
So the good news is, as of today, 6 million doses, over 6 million doses of vaccine have been given in New Jersey, and 2.5 million people have gotten their full series. So either 2 doses of Pfizer, Moderna, or the single dose of J&J. So we are where we want to be. We have to get to 4.7 million, but we're close to halfway there, and we now have mega sites and 800 sites throughout the state. We have a wonderful program with federal government, with the pharmacies, so that there are many, many pharmacy sites throughout the state. There is a vaccine site within 5 miles of everyone that lives in New Jersey. So the accessibility is getting much, much better. Now we just need to encourage people to get there. 70%, I think, is probably the right number, because remember, what we're looking is we're trying to get the vast majority of our population, our communities, protected. And you can be protected either by getting the vaccine, or people who had already had the disease are also, many of them are protected. We do want them to get a vaccine to boost that protection. But if we combine who's already been infected with who's been vaccinated, I think we definitely can get to the point of so-called herd immunity. But there is one catch. Right now, the vaccines are available for people 16 years of age and older. 25% of our population are children. So we can't really get to 70% of the population immunized until we include children. And that won't be too far from now. The Pfizer people have already tested the vaccine in children 12 to 16 years of age, and incredible news, 100% efficacy in that age group. And they checked their blood to see if they made antibodies. And in fact, the antibody response was robust. It was great. So the vaccine, it's no surprise to me, the vaccine worked really very well in people 12 and up. Moderna is testing it as well. J&J were testing it before the pause. So I think that we will have vaccines for children, by the summertime, and that will really help us get to that herd immunity, community protection level.
Thanks, Dr. Fisher. I know that Carrie had suggested that I might share just a couple of our web pages that I have pulled up about some of the resources. So if it's okay with you, I'm going to pull that up on my screen.
Please.
Let me drag this over so you can see what I'm seeing, and hopefully everybody can see this. This is a page that Dr. Fisher referred to in her presentation, which is really our COVID hub page that was built throughout the pandemic, and has a page dedicated to vaccination information and lots of easy boxes to help you find different pieces of information, including the senior hotline with the number. And at the bottom, my favorite thing that I look at pretty much every day when I wake up or soon thereafter, is how we're doing on that tracker. I love to see the green fill in the blue there, knowing that we're heading in the right direction. But this is really the easiest place for anybody to start who's looking for information about COVID vaccines, state programs, vaccination locations. As Dr. Fisher indicated, eligibility is now easy. If you're 16 and up, you've got it. In addition to that resource, or one of the ones that's linked here, right? So if you say New Jersey Vaccine Appointment Finder, you come to this page, which is a newer tool that the state has developed in order to facilitate people more easily finding a vaccine. You can search by county, And you can click the box to find every location in that county that's offering vaccines or just ones that are showing current availability. Most of these places, we update this I almost constantly during the day, Dr. Fisher, is that correct? More often than I knew. So it
Yep.
remains fairly current as long as the center itself where the vaccine appointments are being made is updating their information. So if I click Atlantic County and I say show locations with recent appointments, I can then click on schedule an appointment using their online tool, or I can see the number that they've provided me. There are a lot of our pharmacy programs are growing because a lot of our pharmacies are given federal vaccines directly from the federal government, and the government is increasing their allocations, which means your local Walgreens, CVS, Rite Aid, ShopRite, Wegmans, et cetera, may not have had a vaccination site in it yesterday or last week, but maybe next week it will, and you should continue to check because we're really working towards the fact that everybody can easily within 10 to 15 minutes be able to get to a vaccination site. The mega sites are great in moving large throughput, but we know that that's a long trip for a lot of people. So we continue to work at these local options. So this is really our one place to go right now if you're looking for help in getting an appointment, looking for where it might be convenient and what's showing current availability. We try to have every single site that has vaccines in this system. We can't guarantee 100% accuracy because, for example, sometimes a county, Bergen County gets vaccines from the through the state system every week. They may open up pop-up sites, what we refer to as pop-up sites, a temporary site at a community center or a church. That may not always be captured in this, but any regular standing site should be. So it's really one of the easiest places to go. And we hope that this resolves a lot of the frustration that was happening early on, where in order to find a vaccine, you had to look through our PDF and shop for different sites. It's all in one place right now. If you're a one-stop shopper, I say this system is built for you. The other thing, go ahead, Dr. Fisher.
On that, go back to that other
Yep.
page, scroll down a little bit further and you'll see that some of them say the age. So
Yep.
minimum age 18, that means
Yep.
it's Moderna vaccine. If it says minimum age 16, and if you slide down a little bit more, you'll find some that are 16.
Oh, there's one right there.
There you
Yep.
go. Then that's Pfizer vaccine. Only the Pfizer vaccine is available for age 16. So
16.
if you have a 16-year-old and you're looking for where that child can get a shot, check out, what it says about minimum age.
Now you'll notice, for example, that the Walgreens don't seem to indicate the age here. When you register, usually the sites will check you. They'll ask for a birth date. They'll ask for your age or something like that. And through that process, they'll catch it. But most of our federal program for our federal pharmacies participating get both Pfizer and Moderna. So it's possible they could have either one at a specific location. But thank you for pointing that out because that does help answer a lot of people's questions. And one thing we also know for sure that's worth repeating, because a lot of people ask, if Pfizer is your first dose, Pfizer is your second dose. And you should be able to have that scheduled at the location of your first vaccine at the time of your appointment. The system, when it works as it's supposed to, gets you that second appointment where you've gotten the first appointment. There are circumstances where that becomes not possible, and those are workarounds we deal with. But the system is structured and vaccines are shipped based upon you got dose 1 at your local Walgreens, that your second dose is shipped to that Walgreens. So the very best thing you can do in helping us help the system is go back to that same place for it. The other thing that we'd like to highlight for you is our dashboard, which can be found both through the COVID page here through a link, but also directly through the NJDOH page. And this is really where we do all of our more intensive data tracking and share it with the public, because we feel very strongly that being transparent is a critical piece of building trust. So you'll see here our daily doses administered. I refreshed the page since this morning, Dr. Fisher. So I got the new total of 6.1 million. You'll see those who have at least one dose, the 3.8, and the people who are fully vaccinated, 2.5. You'll also see our breakdowns by gender, race and ethnicity, age groups, and vaccine brand. And one of the reasons, as Dr. Fisher indicated, that the Johnson & Johnson pause isn't really a huge detriment to our anticipated goals is because at this point, it's been a very small slice of our overall vaccination program. We would love it to come back strong in large quantities that we can utilize appropriately. But even if it were, we're still getting to our goal using Pfizer and Moderna. We do pay a lot of attention to the race and ethnicity space because we know that the impact of the virus has been disproportionate on our communities of color. And likewise, we want to make sure that we are addressing the vaccine needs of those communities with the intensity to rectify those kinds of discrepancy. And we're not there yet. We're improving, and we're improving because we've done very targeted outreach through some faith-based and community center vaccination programs in conjunction with FEMA. We've also stood up a very large FEMA site in Newark, which has been probably the reverse of the demographics, whereas most sites might be 60 or 70% white and 30 to 40% other. In Newark, it's been the opposite. So we're being very intentional about that work because at the end of the day, we want to reach our goal with equity. In other words, it needs to be representative of our population writ large. And of course, the age piece is really important because we know that certain age groups, especially over time, have been particularly either vulnerable to the virus or fast spreaders of it. And I'm not going to call out college age kids here, but I'm just going to say that it's great that some of our college campuses are going to be vaccinating all of their students before they return to campus. So we also have the breakdown by county, I should say, and that is by doses administered that we follow very closely. And this is in part for our own record keeping to make sure that where we're sending doses, they are efficiently and effectively being used, but also then to make sure that we are doing so with equity across the geographic landscape. We also can track how many people per county have been vaccinated to look at those numbers as well to make sure that populations are getting vaccinated across the state with some equity as well. The other piece, which is one of my favorite places to go because it demonstrates that Dr. Fisher is not only an expert doctor, but a social media sensation with 492,000 views here, is a resource page from the Department of Health with a lot of video content, which we encourage everybody to lift and use. There are short clips, there are town hall recordings in Spanish and English. I know we're doing one for the South Asian community this evening. There are just quick kind of ads encouraging people to get the vaccine, a lot from medical professionals like Dr. Fisher, because we know that those are valid voices. Also, Commissioner Persa Kelly. We know that people trust and look towards our medical professionals, but we also have union leaders, we have educators, a whole variety of resources here for people to lift, to share, and to use. And one of our biggest asks of anybody in the community who's been vaccinated or ready to get vaccinated, believing in the importance of vaccine, is to help us share this messaging out. Because there are a lot of people who may be reluctant, they may just be shy to ask, they may not have the information at their fingertips and even know who to ask. So the more that our public libraries like this one is doing programs like this and posting information, the links on their website and through the people who use it and people like you who are watching who can share this information out, you really significantly contribute to our effort of reaching our goal. We know in the state level we can make a lot of videos, but we're not going to be the best at reaching everybody in every nook and cranny of all of New Jersey's amazing communities. We need to rely on community outreach and partnership to do that. So we want to make sure that everybody's aware of all of these resources where you could see what's going on, where you can register, where you can easily find an appointment, where you can get all sorts of information and get phone numbers for the call centers if you need them. And we just ask for your consideration in utilizing this to answer your questions and concerns, and then also to address it with other people who may not know that these resources exist. So Carrie, with that, I don't know that I have much more else I need to share and push out. I don't know if you got any questions in from the people who are joining us here today, but I'll turn it back over to you, Carrie.
Thank you. I haven't received any questions, but I have recorded this session and I can share it to the library's YouTube page and social media to benefit people and include the links that you've shared in your presentation. Anybody else? Do we have questions? Last call. I'm not seeing anything, so I want to thank you both for your time and you sharing your information. This is all pretty good news.
Yes,
Thank you, Carrie.
Share that things are happening.
Thank you.
it was a pleasure.
So
Take care.
thank you all for your time. Take care, everybody.
Take care. Bye-bye.
Bye.